This project is initiated by the Health Promotions team of Moreland Community Health Service. Grow and Share is a project that brings together households to establish and grow basic food gardens and share the project produce with one another. The households share not just the benefits, such as tasty homegrown tomatoes, but also the workload, the design of the project, and the fun. Last year, the Moreland Food Access Project undertook a needs assessment to explore the degree of food insecurity in the Moreland region. The study found that there is inequality between access to food across Moreland, and that in the outer northern suburbs, it was easier to get, say, a bottle of beer and a Chico roll than food of good nutritional value. These areas have fewer fresh food outlets and poorer public transport options. It was in this context, and in the context of the overall health promotions approach, that the Grow and Share pilot project was born. This project could equally be posted as a way of building community resilience to the future uncertainties of climate change, peak oil and drought, but that's a story outside of these 3 minutes. Here you can see the basic model that Grow and Share pilot project is based on. I'll now talk you through how we've put this model into practice. First of all, the pilot project involves 8 households in Glenroy and North Coburg who were found through a variety of techniques such as letterboxing and networking. The participants have been involved in planning and designing their gardens and brainstorming how to interpret this model. Participants have been involved in planning and designing their own... Gardens have been established through group working bees and with the support of the Glenroy Lions Club and also community volunteers. The garden workshops and knowledge sharing are around self-sufficient gardening techniques like composting, seed saving, water harvesting and making garden potions. This is the stage that we are now with the project. Participants will now maintain their own gardens, assisted by the workshops, gardening fact sheets and home visits by other group members, local green thumbs and myself. Once the harvest is ready, participants will gather at each other's house, they've decided to do that, to share the produce. Participants are already looking forward to cooking up a storm with their harvest. Okay, so this is the picture tells 1,000 words trick. The things that we really want to achieve through a project such as this are firstly a reduced ecological footprint and the obvious health intrinsic links there, an increased physical activity, increased consumption of fresh organic fruit and vegetables, and increased wellbeing through social networks and support mechanisms. At this early stage of the project, it is too soon to say whether it has achieved all of these things. However, we can already see that the participants' social wellbeing has been enhanced. Trust and friendship has been built within the group. Hugs, phone calls and support have sprouted even outside our very official gatherings. People have felt like they are reconnecting with cultural roots, escaping from social isolation and relieving stress. People are gaining confidence in speaking English and generally enjoying, as one participant stated, the good feeling that people get when they can help one another. I look forward to the next 8 months of this project and the chance to gather the learnings, to grow and to share this type of initiative. I've got more time. So these are photos, these are all the group. It's a wonderful group, very diverse, young and old, from everywhere. And these are some of the gardens we've already established. These are the raised garden beds at the far side that the Lions Club built for access. And the gatherings that we have. I tell people not to bring food, but this meeting I said, don't worry, I'll organise it too much. And they just bring food and share it, and it's